My name is Courtney Bellum, and this is my full head-to-toe video for health assessment. This is my patient that I'm going to be doing a full head-to-toe assessment on. Her name is K.A. for the purposes of this video. Can you tell me what you're here for today?
Just a general checkup.
And can you tell me your date of birth?
10/11/1987.
Okay, so I'm going to gather all my equipment. I'm going to perform hand hygiene, provide patient privacy by shutting the door and closing the curtain. I have the room lit. We're in the hospital for this purpose. Okay, so first thing I'm going to just start by asking some generic questions, and while I'm asking her questions, I'm going to look at her overall general appearance. She appears to be clean. She has good hygiene. Her clothes are appropriate for the time of the season. Her affect appears to be happy. She doesn't appear to be depressed, anything like that. She is in a good mood. Her speech is clear, all of those kinds of things. Then I'm going to start by looking at her scalp, and I'm just going to palpate her scalp to check for any asymmetry, and I don't find any bumps or lumps or anything like that. Her hair appears to be clean. Then I'm going to look at her face, and I'm going to look at her face for symmetry. Her face is symmetrical. Her nose is midline. Everything appears to be symmetrical there. I'm going to palpate her frontal sinuses and ask if that elicits any kind of pain response, any discomfort.
No.
Okay, so nothing there. She maintains eye contact with me whenever I'm asking her questions. Her level of consciousness, she appears to be alert and oriented to time and situation and person. Okay, next I'm going to look at her eyes, and for this part I'm going to inspect the conjunctiva of her eyes, and they appear to be pink. There's no redness or anything like that. The sclera is white with no redness. And then I'm going to get my pen light. Oh, I have a flashlight for this. And I'm going to do the light test, and I'm checking for pupil response. This is the Perla test. Okay, I'm just going to shine this light across each eye 2 times. Okay? And then I'm going to do it in one eye and watch the eye that's not being lit. Okay, and her pupils are equal, and they are round, reactive to light. Now, for the accommodation part, I'm going to ask her to watch a point up there on the ceiling, and I'm going to hold my hand out like this, and then I'm going to move it towards her nose, and then I'm going to ask her to look at it and see that her pupils accommodate to the nearness of the object. Okay, and they do, so we have accommodation. Okay, next I'm going to palpate her temporal artery, and then I'm going to ask her to open her mouth, and I'm just checking the temporomandibular joint to check that it doesn't lock or pop or anything like that, and it doesn't. Okay, then I am going to I'm going to perform the 6 cardinal positions, and what I'm going to do is I'm going to stand in front of her, and I'm going to ask her to follow my finger on each side. Okay. Okay. Follow it to the center. Okay. And that's the 6 cardinal positions of gaze, and what you're looking for is that she's able to follow your finger all the way to the center. And she is. Next I'm going to do I'm going to just explain the Snellen chart. Basically what it is that you have a chart of letters posted on a wall. You have your patient stand 20 feet away, and you start at the biggest letters and move your way down. 20/20 would be normal vision, so that's what one person, the person can see 20 feet away, can see what they should be at 20 feet away. And the further down the chart you get, the smaller the letters get, means that what you should be able to see 20 feet away, that person can see at like 15 or so on and so forth. Okay. Next. So next I'm going to look at her ears. And what I'm looking for is that she can hear normal voice tones, and that all is normal. And then I'm going to use this otoscope, and I'm going to inspect the tympanic membrane. And really you want it to be like a grayish, opaque color. That would be normal. And how you inspect the ear is you pull the pinna, or the top of the ear, up and back. And then you gently insert the otoscope. And you do that on each side. And her tympanic membrane appears to be normal. It's the opaque grayish looking color that I explained. Also, you're looking to see if the person has any excessive wax or anything like that. And her ear canal is clear. There really isn't anything in there that would make it harder for her to hear anything. Then I'm going to perform the whisper test, and what I'm going to do is I'm going to cover the side of my mouth, and I'm going to say 3 different sequence of letters and numbers, and then I'm going to ask her to repeat them back to me. 5AC.
5AC.
Yep. Okay, and then I'm going to do it on the other side.
G74.
Okay, so she has normal hearing. There's no issues. She repeated the numbers back to me. Now I'm going to look at her nose, and what I'm looking for is that her nose is symmetrical midline on her face, and it is. And then I'm going to use the light to inspect each nair, and it is clear. I'm going to ask her to plug one side and inhale, okay, and do the other side. Okay, there's nothing that is making it more difficult for her to breathe through each nostril. It's clear, and then I'm going to, while I was shining the light in her nose, I was looking at her turbinates, and they appeared to be normal. Let's see. Okay, so now I'm going to look at her mouth. I'm going to look at her lips. Her lips appear to be a little bit dry, but she does have lip moisturizer on them. I'm going to ask her to open her mouth. I'm going to shine a light in there. Her mouth appears to be pink and moist and intact. There's no lesions or anything like that. She has all of her teeth present. You don't wear any dental appliances, do you? Okay, all of her teeth are present. I'm also going to look at the back of her throat and see whether or not her tonsils are visible, and that would be a 1+ for just barely any visibility, which she elicits. Also, I'm checking that her tongue is midline. There's no deviation. I'm also going to ask her to say ah. Okay, and I'm checking her uvula to see that when she says ah, that it raises in the back of her mouth, and it is also midline, which it is. Let's see. I'm going to use this tongue depressor, and I'm going to check the gag reflex. And what I'm going to do is just kind of stick it towards the back of her throat and wait until she gags. Okay, and so she does have a positive gag reflex. Stick out your tongue for me. Okay, so everything in her mouth is normal. Her tongue is midline, all of that. Now I'm going to inspect her neck, and I'm looking to see that it is symmetrical with her shoulders, that it doesn't sit to one side or anything like that. Then I'm going to palpate to see that she has any lumps or bumps or anything like that. and she doesn't. So her neck appears to be normal. There's no swollen lymph nodes or anything. Next, I'm going to stand behind her, and I'm going to palpate and ask her to turn her head to one side to see, and ask her to swallow. Okay, and that with the pads of my fingers right next to her trachea while she swallows. What you're checking for is an enlarged thyroid. Do the same thing. Okay, good. And she doesn't have any of that, so that's good. Next, I'm going to ask her to turn her head to each side, checking for range of motion. Bend it down and forth. There you go. Okay, so she has full range of motion in her neck. There's no deviations there. I'm going to check for her carotid pulse, and it's a 2+, which is normal. Next, I am going to do the chest, and I'm just looking that it's symmetrical. It's not barrel or concave or anything like that. It's just flat, sort of. And then I'm going to check for tactile firmitus on each side by pressing my hand against her chest and asking her to say 99.
99, 99, 99, 99.
And what you're looking for is just vibrations of the chest when she says that. I'm going to check her chest for any kind of masses or anything like that. And I don't feel anything. Any tenderness? Okay. So next I'm going to listen to her lung sounds. And I'm going to do this at the second intercostal space. In the fifth intercostal space. Or the third. Now the fifth. Sometimes on female patients you have to lift the breast tissue to get the fifth, and then the mid-clavicular line. Okay, and her breast sounds are clear, and I can auscultate them in all those areas. Okay, and then I'm going to go to her back and listen to her breast sounds. I'm going to start at the top of the scapula. Deep breath. Okay. I'm going to ask the patient to say E.
E. E.
Okay? And you're just listening for the vibrations of performing or from saying the letter E. Okay. Next, I'm going to listen to her heart sounds. We're going to start at the second intercostal space, and it will write on the right side, and that's going to elicit the aortic. Then we're going to go to the left second intercostal space for the pulmonic, third intercostal space left for the tricuspid, and then fifth intercostal space, and that's going to be the mitral, and then okay, and that'll be the heart sounds on the front. Okay, and I am able to auscultate all of her heart sounds with no difficulty. They're not diminished or anything like that. It is regular. She doesn't have any kind of arrhythmia or anything like that, so that would elicit a regular sound. I'm also going to ask her to, we're going to test the range of motion in her arms. And I'm going to ask her to lift her arms up and to the side. Okay, and then hold your hands out like this, and flip your hands over. flex and extend your wrists and fingers. Okay. She has full range of motion in her arms. There's no difficulty there. I'm going to check her pulses. Pulses are normal. They're palpable, 2+. Her hands appear to be pink and dry. Her fingernails appear to be strong. They're not brittled. Her fingers aren't clubbed, which would indicate that she has breathing difficulty or something to that effect. Okay, next I'm going to listen to her abdomen and inspect her abdomen. I'm going to have her lay down for this. Yeah. Okay. So the first thing that you're going to do is inspect the patient's abdomen, and you'll lift their shirt to look at the contour of their abdomen. Is their belly flat? Is it rounded? Is it protruding? And hers appears to be flat. Is it symmetrical? Is it raised on one side or things like that? Hers is symmetrical. It's flat all the way across her abdomen. The skin color, it is pink. It's dry. It's consistent with her ethnicity. A common finding here would be striae, like for pregnant women or somebody that grows too fast, and that's just stretch marks. And she doesn't appear to have any striae on her abdomen. Then you want to look at her umbilicus or belly button. Is it inverted? Is it midline? Hers is midline and inverted. Pregnant women will have an everted belly button after 7 to 9 months. A lot of times it will come back after pregnancy, or sometimes they just have an everted belly button normally and they're not pregnant. Next I'm going to palpate her abdomen and ask her if there's any tenderness when I do that. No. Okay. And if you hold your, if you place your hand just in the epigastric area, you can feel the aortic pulsation from the descending aorta. And I can, and it just feels like a normal pulse. Sometimes if the patient has an arrhythmia, you would feel the deviations there because it is a fairly strong pulse there. Then I'm going to auscultate, and I'm going to listen to her bowel sounds. This one first, right? Left. Okay, and you're going to start with the lower right quadrant and work your way up and around. And you listen for 5 to 20 seconds, longer if you have a harder time hearing bowel sounds, and I don't there. So her bowel sounds are active and audible in all 4 quadrants. Another test that you can perform is listening for vascular sounds, and right above the belly button you're going to listen at the aorta, and then just below that you'll hear there's the renal, left and right renal vascular sounds, and then just below the belly button are your iliac vascular sounds, right and left, and then down in the pubic area in between the hips are your femoral vascular sounds. And what you're listening for is a bruit. Does the patient, you don't want to hear a bruit, you just want to hear really nothing. That would indicate a normal finding. And then we're going to palpate, and this is where you perform deep palpations, and that can be kind of painful, especially if you're looking for something abnormal. On the right upper quadrant, just under the ribs or so, is where you would palpate the right midclavicular line, so to speak, is where you would palpate the liver. If you're listening to the abdomen, about the 5th intercostal space is where you would hear the dullness of the liver. And then on the right side, left midclavicular line, is where you would palpate for a spleen. For the liver and the spleen, really you shouldn't be able to feel anything unless they're enlarged, or there's some sort of issue with them. And about the 9th or to the 11th intercostal space is where you would hear the dullness of the spleen as far as the bowel sounds go. There is a thing called a scratch test. for the to perform with the liver. However, research has shown that there's really no correlation between the two, but what they would do is scratch the abdomen on the right side to elicit the dull sound of the liver. But like I said, research has shown that it is not proven to be of any benefit. Next, we're going to look at her lower extremities. What I'm going to have you do is I'm going to have you lift your legs straight up in the air. Yeah, just one at a time. Okay? And the other one. Okay? And bend your knees and pull them into your chest. Okay? Good. And I'm going to have you just bend your knee up. There you go. Good. And the other one. Okay? And on her knees, what I'm going to do while they're flat is I'm going to be palpating for any bloatment of the patella, which would indicate that there's fluid in her knee, which there isn't. Okay? Now straighten your legs. And I'm going to have her perform range of motion on her ankles now. Good. And there's nothing there in your toes. Good. And I'm looking at her, inspecting her legs to see that they're symmetrical, which they are. One is not longer than the other or shorter than the other. Her skin color is pink and dry or consistent with ethnicity. Hair disbursement would be not there because she's female and she does shave her legs. Does the patient have any varicose veins? And I don't notice any varicose veins. Of course, she is of young age. Now I'm going to palpate her pulses, and I'm going to palpate the popliteal pulse, which is right behind her knee. And they're both there. 2+, which is normal, and I'm going to palpate her post-tibial just on the inner part of her ankle, right behind her ankle bone. And they're both there. And then I'm going to palpate her pedal pulses on top of her, on the tops of her foot. And they're both there at a 2+. I'm going to ask, I already performed that. So when assessing the range of motion, like we already did, asking her to lift her legs and bend her knees and move her ankles, a normal finding would be 5, which indicates that she has full range of motion against gravity with full resistance. So that's a normal finding. Next, we're going to look at the musculoskeletal, and what we're doing while I was asking her to, while I was asking her to lift her legs, observe the joints of her hips. Can you lift your leg again for me? To see that she has any like crepitus or anything like that, and they all move fluidly with no issue. Can you stand up for me? Okay, and what I'm looking here is I'm observing her gait. Her gait. Can you just stand right here and just walk across like this straight? There you go. And what you're looking for is that her gait is smooth, it's rhythmic, effortless. She doesn't wobble when she walks. When she stands, her posture, she is erect, and she doesn't slouch or slump or anything like that. And I'm going to observe her spine by running my hand down the back of her spine to check that there's any deviation in her spine, which would indicate like something like scoliosis. And there isn't. Her spine is midline and it's straight. Also, I'm going to ask you to bend down and touch your toes. And we're just checking the range of motion of her spine, and that was effortless, so she does have good turns from side to side. There you go. We're just checking the range of motion of her spine. Now I'm going to ask you to stand with both hands at your side like that, and I'm going to ask you to close your eyes and just stand there. I'm going to count to 20. This is the Romberg test, and what you want is that the patient just stands there for the full 20 seconds with not falling over or anything like that, and that would be a negative test. Okay, there we go, that's 20 seconds. And that's a normal finding for it to be negative. If it was a positive test, if she were to fall over or deviate to one side or the other, that would be a positive, and that would just indicate that she has some sort of issue with gait and standing still and whatnot. Next, we're going to look at a neuro assessment, and what we're going to do is look at her muscles within her body and see that their size and strength is normal. She doesn't have big, huge shoulders and little bitty legs or something like that. Her muscles are all normal size, and her strength is range of motion is a 5. She has full resistance against gravity, which is a normal finding, and the tone of her muscles is a 5, which is normal. 0 would be that she has no contraction at all, and she is able to fully contract all of her muscles with no difficulty. I'm going to have you sit down again. Okay, and I'm going to do some different tests on the sensory system, and what I'm going to do is get, let me see, a piece of cotton. Is there something? And I'm going to swab this little piece of cotton against different areas of her feet and see that she is able to feel that anywhere I touch. And you can do different variations of touch just to elicit different responses. So, okay, are you able to feel all that? Okay, and so that would be a normal finding. Then there's stereognosis, which is the ability to identify different objects that are within your hand while your eyes are closed. So I have a key here in my hand, and I'm going to put it in her hand. I'm going to, and normally you wouldn't tell them what you have in your hand, but I just did. So. Anyway, so then you would ask them to identify the object that you just placed in their hand. Okay? Can you tell me what that is?
It's a key.
Okay. And really what you want to do is just put different objects in their hand, whether it be a penny or a key, while their eyes are closed, and see that they are able to identify the object that you put in there. And then we'll perform graphesthesia, which is writing either letters or numbers in the palms of their hands, and what you're looking for is that they are able to identify with their eyes closed what you wrote.
7. M. U.
Yes?
One more time. 3.
Okay. So she was able to positively identify that, and you want to do it on both sides because one side can elicit a different response than the other. Also, we're going to perform light touch to her face to see that it elicits a normal response and that there's no sensory defect there, which there's not. And I'm going to ask her to lay back on her back again. Sorry. What we're going to do is we're going to perform the RAM test, which I'm going to have her lay her legs flat. Let's see. Okay. And bend your knees. Sorry, I was trying to figure this out. Okay. So put your hands like this on your knees. Okay. Yeah. And pat your knees. Okay. And then lift your hands, and then flip them over, and pat your knees with the backs of your hands, and lift them over, lift them up, and switch, and keep doing that, and get faster as you do it. Do 3 pats. Okay, and what you're looking for is that they are able to perform this test and increase their speed without any deviations, and she is. Now we're going to do the finger to the nose. So what you're going to do is you're going to stick out your, sorry, I forgot that these could be like this. Okay. So stick your finger out like this and touch your nose and back and switch arms and repeat while your eyes are closed. And get faster. Okay, and what you're looking for is that she's able to perform this test with each arm back and forth to the nose while she's getting faster without any deviations or deficits or anything like that, and she is. Okay, now you can lay down. And this is the heel to shin test. And so what she's going to do is she's going to take her right leg and begin at the knee and run her heel down her shin. And do the opposite and get faster just like the other test. There you go. And that would be a normal response. She can, okay. She can increase her speed while performing the test without any deviations, and that's normal. Next, what we're going to do is I'm going to have you sit on the bed, and we're going to check for reflexes. And what we're going to do is we're going to check her knees to see that they reflex. And I don't have an actual reflex.
This works.
Yeah. Okay. And we're going to check her ankles to see that they reflex. Okay, and they do. And, okay, that looks to be about it. Okay, and, so after performing all of these, next we're going to do one more test, and that's the Babinski test. And what we're going to do is have the patient. We're going to run my hand up the bottom of her foot and see that her toes contract. Right? They're not supposed to do anything. Never mind. Okay? And that's normal. And on the other side? Okay. So she does have a negative Babinski test, which would be a normal finding. If her toes were to do anything, or if she were to have any sort of response, that would be a positive, and that's not good. So neurologically, she appears to be fully intact with no deviations or deficits, and this is going to conclude my full head-to-toe video assessment.